Integrated behavioral health care is sometimes called behavioral health integration, integrated care, or collaborative care. No matter what one calls it, the goal is the same: better care and health for the whole person. In this episode of Being Well, I'll sit down with Sarah Bush Lincoln's Dr. John Lauer about how IBH allows for better coordination and communication while working towards someone's mental health goals.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming a new guest to the show from Sarah Bush Lincoln. We've got Dr. John Lauer joining us today. Welcome to Being Well.
It's my pleasure being here.
Of course, and since you're a new guest to the show, we love to let our viewers get to know who they're learning from. So if you could tell us a little bit about yourself.
Well, I'm from Central Illinois. My father was a minister, a Methodist minister, and I've been in practice in psychiatry now for over 30 years. I was in Springfield for 11 years before I came to this area in 2003. I ran the inpatient unit at Sarah Bush, the psychiatric unit, for 20 years, and I've just started this new program with integrated behavioral health this last year.
Wonderful. Well, and that is our topic today. So we want to make sure everyone is informed, and so let's start and open the floor by explaining what this is.
Well, right now in the United States, there's a severe shortage of psychiatrists. They think by 2025, there's going to be about a 30,000 psychiatrist shortage for the United States. And in rural areas, it's much more than that. And so about 65% of all primary care physicians have nobody that they can refer to as far as psychiatric care. So there's a real need in the primary care for psychiatric services. Integrated behavioral health is the practice of treating someone's mental health issues within the primary care office, so that they can get expert evaluations and get the same kind of care that they would get if they were going to a psychiatrist's office. Most people feel most comfortable seeing their primary care provider, and they don't. A lot of people are very anxious about going to a mental health office or a psychiatrist's office, a counselor's office, but they feel very comfortable going to their primary care office. Mm-hmm. Also, right now, believe it or not, of all the psychiatric medicines used for depression and anxiety, 80% of those are prescribed by primary care providers right now. Mm. And so they're already doing the majority of psychiatric outpatient treatment as far as pharmacotherapy, medications. But by doing this program, they also get the advantage of having an expert in psychiatry help them give those services to their patients.
So if I'm understanding right, this is your primary care doctor, and they're kind of learning the ropes or getting enough information from someone who's trained specifically for that to kind of walk them through that?
Well, all primary care have some experience in psychiatry during their training.
Okay.
25% of every patient that comes into a primary care office comes in for a primary psychiatric reason. whether it's they're depressed or not sleeping or lost their appetite, those kind of things. So they already have a very big population of patients that have psychiatric issues coming in to see them. What we're doing is I'm doing the assessments on the patients to find out what's going on, and then I make detailed treatment recommendations to the primary care doctor about what kind of therapy would be best for this patient, what kind of medications. If we recommend a medication, what dose of medication, what the side effects are, what we're looking for, how we monitor for those medications. And yes, while doing integrated behavioral health, I am teaching the primary care physicians more about psychiatry so that they become more comfortable with it, but also the patients getting the advantage of actually seeing an expert in that field so that they can feel comfortable they're getting the same kind of treatment they would get in a psychiatrist's office.
Okay, so they might not need to see you quite as frequently?
Well, the other thing about integrated behavioral health is that all the treatment is provided by the primary care providers. So I make recommendations. The primary care providers write the medications or talk to the patients about the therapy. They do all the follow-up, and so if a patient has side effects or needs a different medication, they go to their primary care. And if needed, then the primary care doctor will communicate with me back and forth about that patient's needs. Not very often do I see a patient for a second visit. If a patient's having true problems, I'll see them for a second visit, but most of it is the visit is to figure out what's going on, and then I can work through the primary care provider to give them the services they need.
Mm-hmm. And you were telling me before we got started that a lot of the patients you're seeing now virtually.
Yes, this is all virtual. We also have a mental health professional. She's a nurse that works with us, Treva Grimes, and this is a neat thing about integrated behavioral health is that if a patient comes into a primary care provider's office and they're having an acute issue, say like they're having problems at their work or they're having problems with their spouse, Treva will show up on an iPad immediately during that visit to do a psychiatric assessment to find out what their chief complaint is, what kind of symptoms they're having, how acute it is, what kind of treatment they have. And then she will communicate with myself and we'll decide whether or not that patient just needs to be referred to therapy, needs a medication change, or if they need to come and see me for a full evaluation. My evaluations are also done all by telehealth with the patients. We see the patients right in their homes. Some patients like to be seen in their cars because it's a nice sound booth and it's also very secure. They know that nobody else is listening in on them. But patients feel much more comfortable talking to a psychiatrist on their own turf than they do coming to the office and seeing us.
Right. Well, I mean, the four white walls sometimes can be a little bit intimidating. I know I've been guilty of getting a little bit of white coat syndrome myself, so I think that's an excellent option. So let's talk a little bit maybe about some success stories. Walk through kind of how this might look like for a few different people and how you've been able to help.
For the last 5 years, the primary care providers at Sarah Bush have not been able to refer to the outpatient clinic, and that's because they're just full. They can't take any more patients. So for 5 years, the primary care doctors have had nobody to refer to. But for the last year and a half since we've been doing this integrated behavioral health, they have been able to refer to us. And now we have kind of opened up spaces so that when we see someone that really needs to see a psychiatric provider, say their illness is severe, then we can get them into the outpatient clinic now. So now we're able to make referrals to the outpatient clinic where they couldn't do that before. We have had, for example, we had a nurse who had problems with some obsessive compulsive disorder for many, many years. Never saw a psychiatrist, was seeing their primary care provider, was to the point where she was pretty much non-functional. I met with her for psychiatrists, it was a pretty straightforward case, but for a primary care physician who doesn't see this all the time, it was more complicated. We made a medication change, and it's totally changed her life. She went back to work. She's no longer having symptoms. She's doing quite well. So we've had a lot of successes like that where people couldn't receive psychiatric care before are now receiving care.
And so these are people who could possibly have been getting missed by the system because, like you said, these providers haven't been readily available, and just kind of the stress on the health system in general.
Yes.
Gotcha. So these initiatives, you're talking about them coming up in the last couple of years. I have to ask, did the pandemic influence those at all?
There's more telehealth since the pandemic, so it's a lot more accepted by patients and by insurance companies to do telehealth now. So that has made it a lot easier for us to give our services because of that. The number of people who are experiencing serious mental illness has increased since the pandemic. If you look at deaths of despair, and that's people that die from alcoholism, overdoses, or suicides, in 2010, there was about 60,000 people per year who died secondary to those causes. During the pandemic, it was 250,000, 250,000 people died from deaths of despair. Before the pandemic, at any one time, about 1 out of 5 people are dealing with a serious mental illness. During the pandemic, 40% of the American population expressed significant depression and anxiety symptoms that they reported. So that it went from 20% up to 40%, so doubled during the pandemic. And even now that we're coming out of the pandemic, the rate is still 1 out of 3 people experiencing serious mental health issues.
Wow. And so when you are all treating people, what do you maybe notice is the most common things that they're kind of carrying as they come in to connect with their provider or connect with you?
A lot of things that we see are people who have been through treatment with their primary care provider and been on several different medications or therapies, and a very large amount of patients, they actually have been misdiagnosed.
Really?
And so by seeing a psychiatrist, and we do this all the time and make the diagnosis, that helps us direct the primary care providers to a more appropriate treatment. Primary care providers are excellent at treating depression, anxiety issues. Sometimes they just need some help, just like I'm not an expert in hypertension, and sometimes we need to see a cardiologist for that. But so by making a more appropriate diagnosis, that helps helps with guide us about what kind of therapy they should have, what kind of medications they have, and we have better outcomes after that. The patients, a lot of times, they are frustrated because, why am I not getting better? Most people get better. Why am I not getting better? But just seeing them and understanding their issues and kind of educating them about what's going on, a lot of times just gives them relief knowing that, oh, that's why, it's something else.
Mm-hmm. So if I'm somebody at home who is watching and kind of like you said, why am I not getting better, kind of having those feelings, at what point do I maybe do I seek out this program, or does my primary recommend it to me? How does that kind of come about?
You talk with your primary care provider. Mm-hmm. We only take referrals from Sarah Bush Lincoln's primary care providers.
Sure.
And if I was a patient, I would go to my primary care provider and say, hey, I've been having this issue for quite a while. It doesn't seem like what we're doing is really helping. I've heard about this integrated behavioral health. Do you think that would be appropriate for me? And then your primary care provider could either do one of those assessments during that visit, or we could set you up for a evaluation virtually with myself for a full psychiatric evaluation. One other thing that we have available is some people do not want to see a psychiatric provider. They do not want to see a psychiatrist. They do not want to see a psychiatric nurse. And so we have available the opportunity to look back at 20 years of history on the patients and their records, summarize what kind of symptoms they've had, what kind of treatments they've had, and then make recommendations to the primary care provider saying, hey, this worked 10 years ago, it may work now, or she's already been on all these different things, why don't we try this? And that also has been very helpful for those patients who really don't want to see a psychiatric provider.
Say, hopefully you're not taking that personally. I'm sure it's
Now, some people think I can read minds, but not really.
So I have to ask, this seems like more of a kind of a stepping stone of care, but are there ever instances where folks maybe do have to become inpatient at the hospital?
Yes, actually there's been a couple of cases where I've seen patients. There was one patient from the pandemic who had some issues before the pandemic. Mm-hmm. With the isolation from the pandemic, and she also had contamination fears. She had obsessive compulsive disorder. Sure. She was totally paralyzed to the point where she couldn't leave her house, and she was to the point where she relied on everyone else to do everything for her. Because of integrated behavioral health and because we could see her in her home, I was able to assess her and then make recommendations so that she did go into the hospital, and now she's doing better than she has in many, many years. But the pandemic, for people that had contamination fears like obsessive compulsive disorder, the pandemic was just really bad for them.
Sure. Well, and if this is any sort of a note to folks at home, if you're concerned about seeking treatment, just know that it's there to help you, and that it can be a huge burden lifted. It's nothing to be ashamed about. Do you think there's still maybe a stigma that you have to fight against so people will seek this care?
Of course. There always will be a stigma. The other thing about psychiatric illness is that when people are ill, when they're really ill, say like they have schizophrenia or manic depressive illness and they're manic, people lose insight into the fact that they're having issues. So a lot of these people that are having active illness, there's nothing wrong, they don't feel that there's anything wrong with them, so they don't seek treatment. Everyone else around them sees that there's a problem, but they don't. So that's one issue why people don't seek treatment. One issue is that people would have to wait. It's not uncommon if you're referred to a psychiatrist and you can get in to wait 5 to 6 months. If you hear that you're going to have to wait 5 to 6 months, you're probably not going to go to that appointment. So that's another reason. But there's always going to be a stigma associated with mental illness because people use denial quite well, and they, even though they would benefit very much, and there's still a lot of stories about what psychiatrists used to do and what what psychiatry entails, and it's an unknown for people, and they don't always feel comfortable talking about those issues or seeking out help for that.
Since you have the floor, are there any misconceptions that you might want to maybe try to iron out just so folks know?
Well, the main thing about psychiatry is a branch of medicine. Mm-hmm. I am a medical doctor. I went to medical school. Psychiatry is a branch of medicine that studies disorders of emotions. Emotions come from the brain, and so it is a neural disorder, psychiatric disorders, just as much as having a seizure or having a stroke or anything like that. So it is a physical illness that's affecting the brain. It is affected by outside influences such as trauma that people can have. Other medical issues can affect their emotions. But this is something that happens, and it happens during someone's lifetime. They have a 50% chance of having a major mental illness.
Wow. That
includes phobias, which are very common, but even in women have 1 out of 3 chance at sometimes during their life of experiencing a major depressive disorder. So it's much more common than it is rare. And it is a physical illness. It just affects our emotions and the way that we react rather than causing a seizure or causing paralysis like other neurological disorders would.
Mm-hmm. And I think you bring up a great point too, talking about how it impacts women more. This season we're also talking about postpartum depression. We're talking about post-traumatic stress disorder and trying to bring these conditions to light so people understand them, can maybe have an opportunity to recognize them so they know when to seek treatment. So I have to ask, do you only treat adults? Is there this service potential for children as well? What does it look like?
I'm board certified in both adults and geriatrics.
Okay.
During our residency training, we do have some child psychiatry, but I only feel comfortable seeing people to the age of 16. We do have a child psychiatrist, Dr. Hexel at Sarah Bush Lincoln, who does see outpatients, and her practice is currently open. She also has a new mid-level that's working with her. So there is the availability for pediatricians to have their patients see a child psychiatrist. It's the adult patients that have absolutely no other option because the primary care providers have no one that they can refer to. And that's what the area where we're concentrating on now.
Yeah, so in our last couple of minutes here, is there any trends that you maybe notice, age-related or not, gender-related or not, that you are helping to treat?
One of the trends that we're seeing more and more of is increased substance abuse, alcoholism. We don't treat those in the so much in the integrated behavioral health, but we do assessments and we try to make those connections in the community so that those people can get care. Psychiatry and behavioral health services are all in silos. Like you have your medical care here, psychiatric care here, social worker or counseling here, and then your substance abuse. And a lot of times those silos do not talk to one another. And so part of integrated behavioral health is to help break down those walls so that we can get people into where they need to be. Substance abuse issues, it's very hard to get people into the right program sometimes, and so by us doing the assessment and kind of directing them, people are more able to get help.
So we've covered a lot here. Is there anything that I might have missed that you think would be important to tell people?
Well, I think it's important to know that this is a program to help primary care providers and their patients receive their mental health care in the primary care practice so that they don't have to go somewhere else to get their care. So this program is just to augment or to help the primary care provider what they already provide. And really the patients don't have to go to a psychiatric facility or office to see someone, so that it's a lot more intimate and they can keep it between them and their primary care provider.
And I'm not sure how much you can speak to this, so feel free to pass, but as far as insurance, do you know if insurance covers this type of treatment?
Insurance does not cover an assessment when Treva does an assessment.
Okay.
They do not cover when we do a chart review. They do not cover when a physician calls me for advice or we talk back and forth about a patient, but they do cover my evaluations of patients. So when I see a patient and do an evaluation, they do cover that. But there is absolutely no charge to a patient, no charge for an assessment or chart review or for that doctor to talk to me. That is a program that Sarah Bush Lincoln is covering at this time.
Sure.
And so the only charge in the whole this program is the evaluation by myself, and that is covered by most insurance companies and Medicaid and Medicare.
Wonderful. In our last minute or so, is there anything else you'd like to add that maybe I didn't ask about?
Not really. I think that's
Okay.
I think that's the main parts of it.
No worries at all. So, Dr. John Lauer, thank you so much for being here today. We've learned a lot about integrated behavioral health, and if anyone at home is looking for more information, I'm sure you can connect with Sarah Bush's website, connect with your primary care physician, and they can definitely get you hooked up to the right resources. And this is for only Sarah Bush patients at this time?
Yes.
Not at this time. Exclusively. Just wanted to
Exclusively.
make sure that I ironed that out as well. Thanks again for being here today. I appreciate it.
Oh, thank you. My pleasure.
Of course. And we thank our viewers for joining us for this episode of Being Well, and I hope to see you next time.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.